Rahman Rahim. Our case today is common Arab board, Saudi board, Jordan board, and the Egyptian board. Our case is Kawasaki, as was diagnosed as Kawasaki. Based on what? If you see the previous case here, it was actually 2 years with fever 5 days and limping, conjunctivitis, cracked lips, lymphadenopathies, and having murmur, and also CBC, the platelets, it was high. So the diagnosis was Kawasaki disease. Now we are talking about the next step in management of a child. Been preceded questions. Actually, this is patient diagnosed as Kawasaki. What is the proper management for this patient? Here there is intramuscular oral penicillin as outpatient follow-up. So any outpatient, it's not in the choice, it's not proper choice. So you have to admit this patient and started IV immunoglobulin and high dose of aspirin. And to prevent what? To prevent the coronary artery aneurysm. So anything is outpatient is not the proper actually answer. Intramuscular or oral penicillin as outpatient follow-up is not the proper. Pooled of immunoglobulin or IV immunoglobulin with high dose of aspirin in patient, this is the answer. You have to admit this patient and started IV immunoglobulin and high dose of aspirin. What about non-steroidal anti-inflammatory medication as outpatient? Also, anything as outpatient follow-up actually is not appropriate. You have to admit and give him IV immunoglobulin, and you have to start a high dose of aspirin. Actually, all this one precaution to prevent coronary artery aneurysm. Blood culture and intravenous vancomycin in patient admission. Actually, vancomycin in two conditions. You have to start it in two conditions. If there is culture proven susceptible organism, or baby is critically ill, or patient critically ill, at the time you have to start the vancomycin, or you have culture proven susceptible organism, you have to start vancomycin. Viral titer and contact the sport precautions and outpatient follow-up. We mention any option or choices of outpatient is not the proper answer. Should admit, give IV immunoglobulin and high dose of aspirin. So this case of Kawasaki, what is the treatment of the Kawasaki? It will be actually initial treatment, typically IV immunoglobulin and high dose of aspirin. Child usually you have to observe shortly after infusion. You have to observe this patient and you have to assess baby clinically or this patient clinically after you start the IV immunoglobulin infusion. Aspirin is typically to keep the high dose until the platelets count is begin to decrease, and also then you have to continue at lower dose of for several weeks. So you have to start high dose of aspirin. Once the platelets coming down, you after that you can also continue the aspirin for low dose for several weeks. What about the bacterial infection as differential diagnosis for patients with these presentations and the blood culture are usually as part of the evaluation? You have to take septic cup, started antibiotic, because one of the differential diagnosis, and you have to start intravenous vancomycin. But vancomycin again should be reserved for culture proven susceptible organism, resist to other antibiotics or empirical therapy in critically ill patients. So the vancomycin you have to give in two conditions. The first condition, if there is culture proven susceptible organism, resist to other antibiotic. Empirically, if the patient is critically ill, you have to start the vancomycin. So vancomycin in two conditions only: culture proven organism resist to other antibiotics, and the baby is critically ill, or if the baby critically ill. But what about other medications such steroid or infliximab may be used in children who not respond to IV immunoglobulin. So this is the second line of management. If the baby is not respond to IV immunoglobulin or high dose of aspirin, you can start at that time the steroid or infliximab. It will be second line if the baby is or the patient not respond to IV immunoglobulin. So Kawasaki disease, fever more than 5 days, and having macular rash, having lymphadenopathy, having pharyngitis, having bleeding, having cracked lips, and having arthritis. So this is diagnosed as Kawasaki. What is the best management? You have to start IV immunoglobulin and high dose of aspirin. If the IV immunoglobulin does not respond, or a high aspirin, the patient is not respond for this management to prevent the coronary artery aneurysm, the second line it will be steroid and infliximab. It will be, this is the second line if not respond to IV immunoglobulin. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.